is a really dedicated team. The people who come on these trips, give up their time, they give up their vacations, they pay their own way, and they're dedicated to just one thing, is to assist us in trying to get the maximum benefit for the maximum number of patients.
The hospital has a new section that was set up by donations from Germany. The mission we're on involves doing cataract operations on people who don't have money to pay for it.
These are people from a pretty deprived background, people whose sight has been severely affected by cataract and who are unlikely to ever regain their sight if it weren't for the fact that we were able to come here. We've raised money in Australia and we're able to bring along quite a bit of equipment.
We have the opportunity of teaching people as well and leaving some skills behind, and that probably is the most important thing of all. If we can teach to deliver eye care in the long term, then they will be able to develop a degree of independence and look after themselves, and that's really ultimately what we want to do.
Sometimes while you're looking in their eyes, you think, this is actually really beneficial to everyone, and then you suddenly get this emotional rush. But other than that, usually it's just do it, because there's just hundreds of people waiting.
So altogether there's five operating tables at any time. We have a setup where we have 5 beds which are occupied by patients, so when they get taken to theatre, we have another patient replace them. We do an injection in the eye just to anaesthetise it.
We're giving a block which is called a peribulbar block, and we inject that basically just here, and sometimes we do another one immediately. And the idea is that through these 2 injections we can have total anaesthesia of the eye, so the eye will not feel anything, so there's no sensation. And the other thing is that we've got an akinetic eye, so we've got an eye that doesn't move, and that helps the surgeon facilitate the operation. And that way the patient can be totally awake during the operation, and it means that they can get out of here as quick as possible and back to their family.
It was an eye-opener for us, a challenge, and yes, we did wonder how we're going to do this, but the team just hopped in there and we scrubbed the theatres and we just jumped in there and we did it.
It's been 3 years since she hasn't seen anything, not just the grandchildren, but the world. Yeah. It's like someone blindfolded me. I haven't walked around on my own for over 3 years, so I now have to learn to walk on my own again without being led.
She rely on her grandson who just been in to take her back, do all her everyday living sort of like thing, including go to the toilet. I guess how much she depends on her grandson. It also put a lot of pressure on him, I guess, for his futures and things like that. So hopefully it will free 2 people for with one operation.
From what I understand, she's progressively lost her vision over the last 2 years. She's only got light perception vision in both eyes, and that's how she's been surviving. So she's basically heard from her district governor that we provide cataract operations. So she's here to try to see again. The scans turned out really nice, so my best guess is she's going to see a lot better than what she's seeing right now.
These cataracts are very, very late, and a cataract is like a tree growing. So the rings on the tree become more numerous as the years go on, it just evolves more and more. So they become huge and they become dense, and so they go white or they go brown or they go black, and light doesn't pass through them, so eventually you go blind. So the size of the cataract is related to the late presentation. So this person's had a cataract for a long, long time. She was very, very visually incapacitated, almost blind, so she would have been fearful but full of hope that she's going to come out from the operation with greatly improved sight.
After a few days, she will immediately start to see everything again and become independent again.
I'm like a reborn person.
Basically, we have Chel Visay, who's just turned 5 years old. 5 months ago, he's had a metal laceration, which has caused what we call a traumatic cataract in the right side.
His father was grinding and cutting some metal, and some of the metal flew off and went through his cornea and injured the lens, and he finished up with a scarred up cataract.
I'm pretty sure we can do something really positive to help that, so I'm feeling really good and really positive about it.
I think there's some physiological changes with children, right, which makes them a little bit more challenging. The benefits largely to do with return of binocular vision for a 5-year-old, which obviously would enhance his education, enhance his ability to develop as much as possible. And I think that that would be very important in this sort of country and this sort of environment.
At this stage, we are hoping that we can help him, and I think we will be able to help him. But we have to wait for after the surgery and see how we respond to the treatment.
So I think it will be really exciting having to see what the outcome would be tomorrow morning when he'd be able to see in that right eye again.
Everyone's emotion is a bit draining at this point in time, sort of seeing a lot of patients going through that as well. So it's just a bit draining on us, and having to comfort them and sort of educating them because they haven't been told. Some of them have just wanted to have their eye tested, not realising what they have, and not prepared, totally not prepared for the operation. So that was hard for them.
We are trying to do about 60 cases per day just to make it worthwhile being here. It is a bit tiring because the days are quite long. We're going to do it for 1 week. If I did it for longer than a week, I probably wouldn't be able to sustain it, really.
I'm not sure what time it is. It's dark. We started quite early. There's probably, I think, 10 patients left. You tend to lose count of what you do through the day, and we'll just keep on going until they're done.
Well, it's coming to the end of the day and we're all feeling a bit tired, but we're feeling quite good about the fact that we've done more than our quota for today, and a few more people will wake up and be able to see in the morning. That's a lovely thing.
It's a good feeling that you're here to help them the best that you can do. I feel great and see them that they actually happy with the result. It actually changed their life, of course, and it improved the quality of life, more independent. I guess it's a gift from God or something, they reckon.
It's very rewarding because you see that the people really need as much help as they can get. Yes, I can say in a way I'm sort of honoured to be here.
Facilities we have, all the eye testing that we can have for free in Australia, and I think to share it, even if it's just a week, even if it's just 2 weeks, even if it's a couple of days, every little bit kind of contributes to it. The amount of people who line up for hours to get any type of advice for their eyes, it's just incredible.
Well,
That's great. I feel quite happy see all these patients get help. They gain their vision after our work, so it's good. It's quite rewarding actually.
It's a wonderful course, and you get a lot of satisfaction by coming here, seeing the things that we've done for them. And I guess the main thing that struck me is that how much we can change for so little effort and money.
We enjoy doing this, we live for it, for what it's worth, and it's a good pain.
That's a great thing. I think it's something that we need to give back to the rest of the world. We're in a position where we're lucky, we have good training, we have good facilities, and while we can do that, we certainly should offer it to the people who are in need.
We have probably one of the best teams that you could get to come from Australia, certainly from Sydney, and they just jumped at the opportunity. When we take off the patch and the reaction of people, it's magnificent. It still moves me. I guess there's things that you become addicted to. You want more of it. So look, I never get sick of it. Never.
I love the place. I love the people I'm working with and for. For this sort of work these people do, anything just helps. You'll give someone a chance of seeing for the rest of their life. How good would that be?